Good morning, Kate. It's great to see you. Very welcome and good to talk to you today about your chapter for the Handbook of Health Services Evaluation. I think it's got a curious, really fascinating topic. Can you tell us more about it, please?
Sure, thank you, Axel. So I wrote this chapter with my colleague, Dr. Christiana Ludlow. She's the lead author on this. And both Christiana and I used Q methodology in our own PhDs. And Q methodology is quite an interesting, not very well known methodology, but increasingly well known. And it's quite novel because it uses both qualitative and quantitative data. So it really utilizes the richness of qualitative research, but also involves a factor analysis approach where we're looking to group people into different viewpoints based on how they think about a particular topic. So it's very well suited to understanding subjectivity, things like experience, perceptions, priorities, and beliefs on a particular topic, and a topic where we expect that there would be some degree of variability or points of difference. And it can help uncover what those viewpoints look like, if there are particular groups of people that tend to think about a topic in a particular way as opposed to another group, and then provides a nice stepped way of analysing and interpreting that. And the other really fabulous thing about Q methodology is that it is quite flexible, both in the approach itself, but then also in being able to be used alongside other qualitative methods to supplement and further interrogate the findings around why people think different things. In terms of its application to health services evaluation, we see it as really useful for things like understanding different people's experiences of programs, acceptability, feasibility, satisfaction, and sort of their priorities or concerns around barriers and facilitators. So lots of the key evaluation outcomes. However, to date, it hasn't really been used widely in evaluation research, but it is a growing area of interest, and particularly just in healthcare research in general. So yeah.
Fantastic. Fantastic. It's a very unique way of capturing people's viewpoints. And I've been a party to one of these exercises once. It's fascinating. It really involves people and engages them very actively. So that's
Yes,
fantastic. Now, as you know, evaluators of health services are under very much pressure to deliver something, results to the client, or and very often in a timely fashion. So, what do you think Q methodology can do there? What role can it play to deliver that evaluation results quickly and in a timely way?
I think the important thing to recognize about Q methodology is, like with so many methods, it's garbage in, garbage out. So there is a little bit of time that needs to be outlaid in preparing yourself for what the participants are doing in terms of the Q sorting task, in terms of collecting cards, statements, ideas that people will be ultimately conveying their viewpoints using. It is not a method where the answer just comes out the other side in a day or so. However, it is very flexible. It's very engaging, as you said. So it's really useful for different population groups, such as children or people who might have, for example, mild cognitive impairment. And the other part of it is that it usually doesn't require the very large sample sizes that we're expecting for example, survey methodology. Often for a Q methodology study, we're talking in the realm of sort of like 25 to 40 participants. Far more important is that you get people that can have a very sort of thoughtful and engaged and different perspectives on the issue than it is to have, you know, representativeness of every single person in the population. So there are parts of it that can be expedited in the sense that you're not recruiting in the hundreds of people, but it does require a little bit of work to set up.
Brilliant, excellent. Well, fantastic. You made a good case for Q methodology, and that's also what your chapter is called, making a case for Q methodology in health service evaluation. Thank you very much, Kate, for this really fascinating talk. And it's a great contribution to the handbook, of course.
Thank you for having us, Axel.